All right, good morning, everybody. As my arms flail, I was not paying attention, and we're a little bit behind. Today is Wednesday, February 23rd. We're here for board session at 9 a.m. in the Senator Hearing Room, 555 Court Street Northeast. And if you would, please join me for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Are you going to hurry this morning? He's like racing ahead of me.
Just getting it done, you know?
You're getting it done. All right, we don't have any public comment today, so we're going to move on to our first and final presentation from Katrina Rothenberger for the COVID-19 update.
Good morning, Commissioners. My name is Katrina Rothenberger. I'm the Public Health Division Director with Marion County Health and Human Services. And I'm just going to share a little bit about where we're headed as we have discontinued case investigation and contact tracing for the most part, and how we are doing right now with our cases. So in the previous 2-week period, February 6th through February 19th, there was almost a 50% decrease in cases compared to January 30th through February 12th. We are seeing cases drop pretty dramatically, and our 7-day daily case average is below 87. Most recently, we have received a bunch of the at-home test kits from Oregon Health Authority. And when we first received those, we pushed a bunch out to rural areas in Marion County that didn't necessarily have access to pharmacy. And then we held we call them pods, a point of distribution, so a drive-through for our adult foster homes and group homes to come collect some at-home tests. And then we still have a bunch left, and we are doing another test kit giveaway pod at the People's Church on March 3rd from 3 o'clock to 7 o'clock. And we're also going to be distributing PPE. So we have a lot left in our Public Works facility, and we're gonna start reducing the amount of PPE that we have on hand. So because the masks are readily available in the community, we will keep a bunch on hand as well to support long-term care facilities and other congregate settings that need immediate access, but we are encouraging folks to plan accordingly. These types of healthcare facilities should have a plan in place to buy their own PPE at this point if they need it. So, but we will keep some on hand for those emergency situations and for our staff. We wear masks regularly because we're dealing with other types of issues. And we'll rotate that stock too, so that we can keep it up to date and doesn't get expired. So even if things do become expired, we'll still keep some on hand. I learned that lesson early on. So
It's a good story. We should tell it one more time.
You have Sam
just
tell
for
it.
old time's sake.
You should have Sam tell
Have
it. He's
Sam.
a really good storyteller. Yeah. Well, when we were moving buildings, there was some discarded PPE that was expired, but they couldn't see the future and know that we would need this expired PPE.
And this is one of my first meetings with Katrina. This is right at the beginning of COVID. She says, they discarded this PPE because it's expired, and you can only use expired PPE in a pandemic. I believe that was the direct quote, and we were in the middle of a pandemic. It was, The irony wasn't lost on any of us in the room.
Yeah. Oh, good times. I'm glad we're not.
Some
back
people
at
go
that
through my
point.
refrigerator and throw things away just because it has a use by date. That's just marketing stuff.
Yeah, so we have seen the amount of work for our staff decrease considerably, and so we've been reassigning folks to support our long-term care facilities, because we still have a role to play with their outbreaks and supporting them through that, and making sure they have PPE and testing available, and assistance with these point of distribution clinics. But at some point in the very near future, we anticipate that a lot of our staff will be going back to their regular pre-COVID jobs, which is really exciting and really needed. At the risk of another headline in the newspaper, syphilis is a real concern, and so is congenital syphilis. And so we have some plans to start there sooner rather than later, because alongside our partners in Polk and Yamhill County, because we're all experiencing a similar increase. And OHA did put out a press release about it a couple of months ago too. So
Thank you for that cover. I'm happy to be the headline for that. We need to take care of it. So
Yeah,
it's ridiculous, but still.
It's one of our priorities, because, you know, I think 5 years ago, we did not see this level of syphilis in the state of Oregon. So it has increased dramatically over the last 5 to 10 years. And it's presenting in ways that our community physicians might not be able to recognize. And so with the onboarding of our new physician, Dr. Castillo, with her background in infectious disease, we're happy to have her on board and get her out in the community and have those conversations and help, and go out on our mobile van too. That'll be getting back out into the community, which we're really excited about. And I think Ryan will talk about it in one of his contracts on the agenda later. So I think that's all I wanted to share today. We're just kind of ramping down and trying to be thoughtful. We're going to capture some lessons learned, because we set up a department within a department that was very well functioning, and we want to commemorate our team's work on the COVID response, and just write down all of those really good lessons learned for internal purposes. It could be applicable to a future incident or outbreak or whatever. So our team is, I'm just so proud of them, and they've done a really phenomenal job. So happy to see what we can do after COVID.
Commissioner, do you have any questions?
I do have a question, Katrina. We've been getting a lot of questions from constituents about whether or not we're going to be recommending that school districts continue to mask after March 31st, the date when the governor says that she's dropping the mask mandates. We are not recommending that. Is that correct?
Yeah, I think what the most important thing is that the school districts and the parents and families are making the best decision for them, the schools and themselves. We don't really have guidance at all, and it's that we have a role to play in that decision either. So, and I do believe the mask mandate will be lifted prior to March 31st.
Based on the hospital numbers.
Yes.
Right.
Madam Chair, if I may, sorry to interrupt there. We talked about this a little bit yesterday in a meeting. Can we get a letter from you? I think that would be something we need to talk about, a letter to the school districts, basically telling them that it's their decision. We can maybe.
Yeah, so I actually sent an email off to staff to ask them to draft one. And I think we do need to have the conversation about who it comes from, because I think the Board of Commissioners is the local public health authority in partnership with the health department. I feel comfortable sending it from us, but I really want to make sure that we have the right information in there. I did ask legal counsel recently to review the Oregon Health Authority's recent rule that brought down the reduction in masks across the state, and kind of their punt to local authority and what that looks like for our responsibility versus the school district's responsibility. And it's pretty clear in the rule that the masking in schools is the jurisdiction of the school district, the school board, in all those districts. So I forwarded that to both of you yesterday
thank you.
to review. So we'll draft something and get it over to make sure that it makes sense to all of you, and then likely have Ryan or Katrina forward it on to your contacts in the districts, because I think it's important for them to know our position, but it's important for the public to understand what our position is as well, and we don't have that authority, and I personally will not be having the discussion. I think masks should be optional at this point, and I want families to make those choices for themselves.
Yep.
So your flashlight's on.
Oh, thanks.
You're welcome.
I'll fix it.
Was it, what was the number? Under 400 was the hospital number?
400,
You know where
yeah.
we're at today statewide?
Yesterday, I believe, was 597, so they do anticipate that it will reach that 400 threshold very soon.
I saw in Ryan's text this morning, we had 20 go in today, or whenever that period is that we looked at. So I don't know how many we have total, 70.
Currently admitted as of this morning is 74.
That's what it was, yeah. Okay, thank you.
Yeah, thank you, Katrina.
Thank
And thank
you.
you for being here regularly to provide us the information and for the public to be informed. It's been, I think, helpful because I know a lot of the website information lags from Oregon Health Authority, and so that causes some concern for folks. But having you here, I think, has been a tremendous help for people to watch and listen.
Well, thank
So,
you.
We'll see you back in another capacity.
Yes, thank you.
All right, let's move on to the consent calendar. Commissioner Cameron.
Okay, Madam Chair, I'll move the consent calendar. First item under OLCC, Board of Commissioners, OLCC applications, recommend approval of the Farm on Golden Hill LLC, DBA The Farm on Golden Hill, Silverton, Oregon. We have 3 items under the tax office today. The first one is to approve an order of a property tax refund in the amount of $16,518.41 for Loretta LLC under the tax office. The second item, approve an order for a property tax refund in the amount of $53,369.71 for Windsor Court Apartments, Inc. And finally, under tax office, approve an order of a property tax refund in the amount of $101,552.12 for Center Street Properties, Inc.
I second the motion.
All right, we have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
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 Aye, the motion passes. We'll move on to our first action item, and Colleen Coons-Chafin is going to join us to consider approval for an order adopting revised Marion County Administrative Policy Number 1005 and Procedure Number 1005-A, parking at Marion County facilities. Good morning.
Good morning, Madam Chair and Commissioners. Colleen Coons, Chafin's Business Services Director. It's overrated. Don't ever hyphenate your name.
Okay. I won't.
Don't ever. Business Services Manager.
Still got it,
I'm
Colleen.
sorry.
You still got it. You still got it.
Today, we're here to update you on the Marion County parking policy and related procedure, as well as the order that's before you, 1005 and 1005A. We discussed this with you previously, and it's really just a lot of housekeeping type stuff, as well as we had to add a section for electric parkers, because we're having more of those come with the need to charge. We did add some language about what that charge is. There's different sizes of batteries, basically small, medium, large, and then we also have people who can park in a spot and just plug into the electrical outlet that's there. So they range from $5 to $7.50 to $10 to $20 all day, which would be in addition to the regular parking, just to help pay for the electricity that they're using. So from time to time, we update these policies with new standards. There really hasn't been a lot of new things. It's really just to clarify the eligible parkers, primarily here at Courthouse Square and the courthouse across the street. We opened up another 18 spots across the street because we have more employees that we need to get parked. We changed parking access from all hours to business hours, just to keep inside with business hours of the buildings themselves. Payment was used to be monthly, now it's twice monthly, so when you get paid, you get half of that taken out. And then, again, the electric vehicles. Revenues from this policy go toward paying off the debt and any improvements like signage, striping, and cleaning of both parking facilities. So we're recommending approval of these changes, and if you have any questions, happy to answer them.
Any questions?
Yeah, Madam Chair, thank you. Colleen, just, you said you went up to $20 all day. That's per month, right?
Yes.
The charge is per
Yes.
month. Yeah, thank you. Just to clarify.
Okay. I'll take a motion.
Okay, Madam Chair, I move that we approve an order adopting revised Marion County Administrative Policy 1005 and Procedure 1005A, parking at Marion County facilities.
I'll second the motion.
All right, we have a motion and a second. Any further discussion? All right, hearing none. All those in favor, please say aye.
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 Thank you, and I'd like to echo, working with Katrina and her team has been phenomenal, and we've been hand in glove with them, and they've just been awesome to work with, so.
Thank you. I just have to say, I don't know if it's the name hyphenation that causes the lag today, or it might just be all the energy got sucked into 222 Tuesday yesterday and all the hype, and we're all just tired from that. All right, moving on to Health and Human Services. To consider approval of amendment number 3 to the incoming funds intergovernmental agreement with the Oregon Health Authority to add $35,404 for a new contract total of $14,158,297.32 for the Public Health Emergency Preparedness and Response Program through June 30th, 2023. That's a really big number. I could test my kindergarten skills there
Yes.
for a second.
Good morning, Commissioners. For the record, Ryan Matthews, the Administrator with Marion County Health and Human Services Department. And I am here seeking approval of an amendment for $35,404 to increase our public health contract by awarding additional funds for public health emergency preparedness. So I know that obviously we've been under declared emergency now for 2 years, so it's easy to sort of consider these funds as, related specifically to that. But these have actually been around for 20 years, give or take, in preparing our public health system to be ready to respond in case of an emergency. And that emergency could take, many forms. We didn't know we'd necessarily be in a pandemic. It could have been, I know we've used it in the past for West Nile trainings, any kind of emergency that you can sort of think about. But these funds really are for us to build our capacity for our ability to respond to an emergency. Whether that's making sure the staff are trained in all the incident command structure, performing tabletop exercises, having an emergency response plan, and how we would respond, what resources we would need depending on the scope of the emergency, and to maintain continuity of operations. These funds specifically are actually carryover of unspent funds that happened statewide last year, so they are redistributing those funds that they were able to carry over to all local public health authorities based on the population formula that they have in place. And again, that formula has been around for a while, where there's kind of a base funding level, and then another percentage of it is based on the population of your county. And so this $35,404 is intended to be awarded to Marion County, and I think that what we also want to utilize these funds for is really to think about, kind of the future and what additional trainings and how more of our department can be involved. I think one of the things that we've learned over the years is that responding to an emergency is not simply a public health issue. We need to make sure that we have infrastructure on the behavioral health side and other areas of our department that are ready to respond, because you really don't respond to an emergency in that sort of vacuum. There are always, whether it's from the wildfire where you felt like obviously what we needed on site was people to help deal with those in crisis who had just been through a traumatic experience. Responding to an emergency really requires infrastructure being built in our whole department and our whole organization. And so these funds will continue to work towards tabletop exercises, training of staff, and those sorts of activities. So just, are there any questions that you might have about these?
Commissioner?
You kind of mentioned what these funds will go to, but it seems like we have a big pot of money, and it seems like we're adding $35,000, which is a much smaller pot. What's the urgency?
Oh.
It's like we couldn't do these things if we didn't have this extra $35,000, or is it just sort of there was money left over the state wanted to give us? Like, what happened here?
I think this was more, this contract action is more related to the state has carryover funds that they're distributing.
Okay.
I think that they're, when we kind of, as we're transitioning now out of a pandemic and we start thinking about lessons learned that we have, I think we'll be able to identify areas in which we could put these resources to, again, build the infrastructure, maintain the training. I mean, right now, we've been living it for 2 years, so it may not feel like, oh, you need tabletop exercises and you need to do these, but it is muscle memory. Like, you do need to maintain these things ongoing, and you do have new staff coming in all the time that, again, you need to make sure that they're trained and ready to respond when the need arises. So we'll utilize it for that, whether it's in terms of like a sense of urgency. It wasn't money that we were desperately anticipating needing, but we will put it to good use and make sure that our public health team and our department as a whole is ready to respond to any needs.
Perfect, thank you.
Yeah.
Any questions, Commissioners?
No, good, thank you.
All right, then I'll take a motion.
All right, Madam Chair, I'll move that we approve an amendment number 3 in the incoming funds intergovernmental agreement with the Oregon Health Authority to add $35,404 to a new contract total of $14,158,297.32 for the Public Health Emergency Preparedness and Response Program through June 30th, 2023.
I'll second the motion.
I have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
Aye.
Aye, the motion passes. Thank you, Ryan. And we're going to move on to consider approval of amendment number 4 to the incoming funds intergovernmental agreement with the Oregon Health Authority to add $373,605 for a new contract total of $1,331,614 for HIV early intervention and outreach services through December 31st, 2022.
Thank you, Commissioner. So I am seeking approval of the 2022 contract with Oregon Health Authority to support our HIV early intervention and outreach services program. This is an annual contract, and it started in 2018. So this would be extending it through 2022. And these funds actually go to support those in Marion County that are newly diagnosed with HIV or have an unknown status or are in significant risk of acquiring HIV. Some of the services that we provide under this agreement would be basically outreach to support individuals and connect them to resources, connect them to HIV Alliance, for example, who does a lot of the case management and other services. And so we also are really using these funds to provide education and awareness of HIV and other communicable diseases in our community and promote testing. Katrina mentioned the outreach van that we have and some of the testing events that we have planned kind of as we transition out of putting our resources so heavily towards COVID. We really need to address the other communicable diseases that are prevalent in our community, and whether that is syphilis or HIV. We want to make sure that people are tested for those and get connected to services and supports as need be. And those could be, held at, homeless camps, farms, all kinds of different locations that we can access, give people access to these services. There is a component of this that isn't part of our contract directly. The state does contract with HIV Alliance, and so HIV Alliance has their role in terms of case management and the services and supports that they provide. And what the contract that this entails is really more of education, outreach, access to testing, and then connecting to resources is kind of the role that we fill within this. Are there any questions about this contract?
I don't have any questions. I just think that I'm the generation where HIV was such a prominent discussion. There was TV commercials. Growing up as a kid, the after-school special commercials were about HIV, prevention, AIDS, and things. We don't see that anymore. We don't, other than COVID-related commercials that the governor's putting out, there's actually not kind of an educational series around things that you need to be aware of. And I'm not surprised, because I went on this really great tour with Katrina and talked to her staff around just to learn what they're doing and the diseases that we're managing here in our county, obviously the state, but I think folks might be surprised to even to be hearing this. And so I'm curious I know that you're going to be doing some modernization of your programs going forward, if you're going to be expanding communications, if you will, on awarenesses. I don't want people to be afraid, but I want people to be aware that this is a disease that's never going to go away, just like COVID, it's never going to go away, right? But this is around, and there are resources for people to be supported. I think more often than not, they get connected through different providers, but I don't think the average person in the community understands really at all what Katrina's department does. And we're funding a van for a fair, there's one van, obviously $1 million goes to a lot of other efforts, but are you guys going to be doing some more outward communication of what's going on in our communities. I mean, I appreciate that we're having this discussion again today about syphilis, and that's a concern for us. And I know that I took some heat about it a few months ago, but it is a really big deal.
You know, I'm old enough to also remember public service announcements on TV that were kind of a regular thing. You're right, we don't see that to the same level that we used to. That is unfortunate, and maybe part of it just speaks to the fact that people get their communication, get their information in a lot of different ways. I do think that the public health communication has been so largely focused on around COVID the past 2 years that has really been our primary, but we have a communications coordinator. I think we've built enough of a following of our social media pages where I do think there's the opportunity to really get a lot more information out, and we do try to sprinkle it in, but I think it gets drowned out in other priorities. But to your point is, yes, we need to do more, promotion and education and community outreach, whether that is, through social media channels, through events, through other partnerships, and that is work that I know public health is really focused on and wanting to do. And I think as we continue to shift resources away from our emergency response related to COVID, we can put those energies towards other areas, and we can use some of the skills and some of the relationships that we've built along the way the past 2 years to hopefully, use those in other ways. Because I think that, people obviously now have the ability to live with HIV in a way that was different than what we knew of in the 80s, so which is great. But it is still a disease that is in our community, and those numbers over the last 5+ years, have grown and increased. And I think that it's not something that people are necessarily aware of, and so we do need to do a better job of informing.
I'm glad that you're going to be focusing on that, and I certainly hope. I mean, I have kids in our education system that take these, health classes, and it's a standard process, right? Kids just go through it. Oh, I have health today, or I have, STD discussion today. It's actually not. These kids not absorbing, and so maybe there's an opportunity to partner more with the districts to create more of an awareness outside of the standard classroom setting where they're just sitting and watching a video or reading a book or doing a handout to get their attention. We had Salem Kaiser recently, about a year ago, had a presentation from a young man that came and talked about basically cyberbullying through cell phones and how kids were being preyed on. And they did gymnasium-style presentations, and that made a difference for these kids. They're sitting together and they're being presented information, and while some of them probably thought it was pointless, they took the information in and they left with it in a different format than the boring standard, oh, I have to go to sex ed today, or whatever it is in school. So I just would like to see our modernization be able to reach the youth so we can try to reduce those numbers for HIV. So anyway, thank you for all you guys are doing.
Yeah, thank you, Madam Chair.
Sure.
Ryan, Katrina's predecessor, I remember I used to get a quarterly report, like a green sheet or something that came from the health department that had the stats. Somehow it got to me and I haven't seen that in a long time. And I know we've been busy with COVID, but it had the number of cases and deaths and births and a bunch of statistics that were kind of really interesting to see. It was a snapshot in time of what was going on in public health. If we have that information, I'm sure it's still being collected. If it's able to be produced, it'd be a really good thing for the board to see.
I'd be interested in seeing that.
Yeah.
Okay, all right.
Yeah.
Yes, we'll look into that and get you that
Thank you.
information. Thank you.
Well, and I think we should mention, too, Madam Chair, that there's been real strides made in treatment for HIV and AIDS.
Right.
Like just the other day, I think 2 days ago, there was an NPR article about a gal who maybe is cured from HIV, which has never happened before. So,
Wow.
So I mean, we're on the edge of beating this disease, and it's definitely not time to take our foot off the gas. So.
Agreed. I just think it's awareness. I mean, it's like the word has just become a part of my vernacular these days, but syphilis is something that you can cure and manage. You have to know about it, and doctors have to know how to treat it, and they have to seek access to treatment. And I think that's what we're talking about here, is just making sure we're a public service campaign, but more importantly that we're providing services into the community to help people. They just need to get connected. We have it available. And I know our team is doing a lot, and I'm sure they're excited to do more.
Yeah, I mean, there's definitely a lot of resources out there, and this is not even specific to public health. It's, people just don't always know where to get in the front door.
Right.
Where to get on the path that it's gonna take you all the resources you need. And we struggle with this, whether it's in addictions, but mental health, in all areas. It's a complex system and it's hard for people to navigate.
Yeah.
Yeah.
Well, thank you for the efforts that you're putting in to continue to do the work.
Great.
Okay, I will take a motion.
Madam Chair, I move that we approve amendment number 4 to the incoming funds intergovernmental agreement with the Oregon Health Authority to add $373,605 for a new contract total of $1,331,614 for HIV early intervention and outreach services through December 31st, 2022.
I'll second the motion.
Okay, I have a motion and a second. Any further discussion? Hearing none, all those in favor, please say aye.
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 Aye, the motion passes. Thank you, Ryan. Thank you, Katrina. And I'll read the calendar today, because this was a quick board meeting. Today is February 23rd, Wednesday, 9 a.m. We're here for board session in the Senator Hearing Room, first floor, 555 Court Street. And then later today, at 4 p.m., we have a FEMA recovery check-in meeting in the Commissioner's Boardroom, 5th floor, 555 Court Street. And then tomorrow, the 24th, on Thursday at 7:30, we'll be up in Mill City for a cities county meeting at the KYAC radio station at 475 Northeast Santiam Boulevard. Again in Mill City. And then at 9:30, we have a Marion County Health and Human Services quarterly meeting located in the Commissioner's Boardroom, 5th floor, 555 Court Street. And then Tuesday, March 1st, we have the Mid-Willamette Valley Homeless Alliance Executive Committee meeting, which is virtual. And Tuesday, the 1st at 1:30, we have an Economic Development Program budget discussion, the Commissioner's Boardroom, 5th floor, 555 Court Street. And then at 3:30 on the 1st, we have a Team Salem Presents Airline Recruitment Update, which is virtual. And then on Wednesday, the 2nd at 9 a.m., we have board session again here in the Senator Hearing Room, 1st floor, 555 Court Street. And then on Wednesday, the 2nd at 12 p.m., we have the city's Marion County meeting, which is going to be in Aurora at the Butteville General Store, 1067 Butte Street Northeast. Jan, don't we have a BOC CAO today? It's not on the calendar, the printed calendar. What time is that
We
starting?
have one at 11 o'clock for BOC CAO, and we have another one with policy analysts this afternoon.
Okay, so I'll look at my calendar. We at 11 a.m., the commissioners have a BOC CAO meeting in the commissioners' boardroom. And then at 1:30, 1:15, we have a BOC policy analyst meeting, the commissioners' boardroom, 5th floor, 555 Court Street. Not sure how come that's not current, but anyway, we're busy. Yeah.
Okay.
All right, thank you. Is there anything you'd like to add today before we adjourn?
Busy times.
Busy times. Hopefully it's a nice drive for me tomorrow up to Mill City. Let's pray for sun and no ice. Okay, well with that, we'll adjourn.
All right.